Hey listeners, it's Stephanie Wynn, your host of the Health and Healing from the Inside Out podcast, and I've got some amazing news to share with you. My brand new book, Navigating Inflammatory Bowel Disease, a 6-week blueprint for better gut health, is finally here and available for pre-sale. Maybe you or someone you know is struggling to figure out life with Crohn's disease or ulcerative colitis, which is 2 forms of inflammatory bowel disease or IBD. This book is written just for you. It's simple, easy to follow blueprint, packed with practical tips and real life advice to help you manage symptoms, find the right support, and feel more control. This book is like having a friend who truly gets it, like walking with you every step of the way. And the best part, you can get your autographed copy today. Just head over to navigatingibd.com to pre-order now. If you've been looking for answers, hope, or just a little guidance, Navigating IBD is here to help. Don't wait. Pre-order your copy today and start your journey to better gut health. Welcome to the Health and Healing from the Inside Out podcast with Stephanie A. Wynn, an online health and wellness podcast where I, your host, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. The Health and Healing from the Inside Out podcast is a mixture of special guest interviews from healthcare professionals, IBD survivors, Crohn's survivors, ulcerative colitis survivors, and community thought leaders. Be sure to select the subscribe button and let's start the health and healing process from the inside out. We are back for another episode of the Health and Healing podcast from the Inside Out. I am your host, Stephanie A. Wynn, and we are super excited. Listen, we are taking it to the community, our community of people who are in this fight for health equity and the removal of health disparities. And so we have a special guest today. Super excited to have her here. We have Lolita Dash-Pitts in the building, and we're gonna get right into this interview because listen, y'all, we don't know what we don't know, and we don't know how to navigate because we don't ask the right questions, right? And so our goal is really, truly here at the Health and Healing Podcast is to give you these resources, these tools that you can use and go back and help your fellow person that maybe you're caring for. Maybe you know somebody that has inflammatory bowel disease or IBS, and you want to give them something that they can use to better them on their healthcare journey. So that's what we're here, and that's what we're all about. So we're going to get right into this interview. Ms. Lolita Dash-Pitts, welcome to the show. Welcome, welcome, welcome. Would you like to introduce yourself to the audience?
Sure, yes. Thank you, Stephanie, for the invitation. Whenever I get an opportunity to share my experience and educate individuals, you know I'm on board. So I truly, truly appreciate your invitation to do so. I'm Lolita Dash-Pitts. I'm born and raised in the community. I live, work, and play. I'm also a business owner, Adelaw Consulting Solutions, where I assist small businesses with record-keeping management, financial management, certifications, and grant writing. And I'm also the executive director of a nonprofit organization called Front Porch Community Development Association, which has been around for over 20 years. So I'm well diverse, and I got a lot of information and expertise that I certainly want to share today. So in dealing with my chronic diseases, which is IBS and Barrett's esophagus, I had to change my mindset. I had to change the way I thought about and accepted the diseases. And in doing so, that means I had to restrict myself to certain foods. I had to drink more water, less sugar-induced beverages and soft drinks. And also, I have to eat, have a certain timeline to eat, like not eat beyond 7 p.m. or 8 p.m. because of the digestive system and how long it takes to break down certain foods. So that's how I was able to adjust to my chronic illnesses and deal with them, because I certainly don't want them to progress to cancer or stomach cancer.
Well, how does IBS affect your daily life, from your routine to your work or school responsibilities? How has that affected your daily life, Ms. Lolita?
Well, as I stated, it starts with the mindset. If I have a workshop or something that's going to be extensive, I know that I have to limit my food intake. As I stated, drink plenty of water. Water is the key, you all. It is. It's essential. And I know sometimes I go on that drinking binge where I want a soft drink or whatever, but I have to remind myself it's not good for me, my body, and my longevity as far as how long I'm going to be here. So those are the ways. It's just setting that mindset and being committed to making yourself healthier.
Awesome. Awesome. So, I definitely can relate. Sometimes you do want to fall off and you do want to. I'm a tea drinker, right? So I love me some sweet tea. Let me tell you, it just cannot be any sweet tea, but it has to be freshly brewed. Okay.
Yes.
And it just has to give you that refreshing. I mean, it's so good that it's so refreshing, right? And so I know that sweet tea is not good for me. And like you said, you have to stay hydrated. Hydration is key. So I definitely can relate to sometimes we fall off, you know what I mean? And that affect our daily life, that affect the daily activities that we go through with dealing with, IBS or IBD. So I definitely can relate to that. So what has your overall experience been like with healthcare providers while managing your IBS?
Well, for me, it's been very good. And what put me on that plateau is that I realize and believe that I am in control of my body and my health. And with that being said, when I go to my healthcare providers, it's a communication, it's a dialogue. It's not going to them and having them relay what they think, but actually speaking to them, interacting with them, and sharing with them what my experiences are as far as my health. So that's important. You have to communicate. Don't rely on your providers to, be your savior. You're your savior. You got to take control of your own health and your own body. So, that was the process. If I didn't understand certain questions or information they provided, then I asked for clarity or confirmation. There's nothing wrong with doing that. If you don't quite understand their language, tell them that. Say, communicate with me where I can understand so that we can be on one accord. But the most important thing is communicating and having a dialogue and knowing what's best for your body and not relying on the doctors or surgeons to tell you what's best. You know best what's for your body.
That is awesome, because let me tell you, one of the things that a lot of patients do, and that's all a part of patient advocacy, is not ask questions because they don't want to feel like, oh, this is a stupid question, or I don't want to sound like I don't know what's going on. No, like you said, ask those questions because you don't know their language. And that's why I'm glad that we're having this dialogue on this podcast and this platform, is because I want providers, clinicians to understand that all patients aren't the same. They don't understand the same. They don't understand the language that you're speaking to them. And so sometimes you have to meet the people where they are. And that may mean breaking it down for them I'm not saying to dumb down yourself as a clinician or provider. I'm saying make the information that you've just given them understandable so that they know how to go and better help themselves and advocate for themselves and make the right decisions for when it comes to their health. Period. Right. So that's going to lead me into our third question, which is, how do you think raising awareness can improve the experiences of some IBS patients? Maybe there's IBS patients or IBD patients out here who didn't have a good experience, right? How do you think raising awareness can improve their experience overall?
Well, first and foremost, Stephanie, it's education. Once you're diagnosed, it's your responsibility to get as much information and resources regarding that specific illness or disease. So education is the key. Many individuals suffer from IBS and don't even know and realize that they have it because they self-diagnose and think, oh, it's just an upset stomach, or I ate something that didn't agree with my system. And, we all do it. We minimize our symptoms. So with that being said, if it's something that's reoccurring and you do it constantly and it's consistent, every time you eat, you have to run to the restroom, or you're having these stomach issues, then I would suggest you really seek medical attention and advice, because it's probably going to be more than something than just a minor stomach ache. So that's first of all. So educating yourself. And then I would say also being more serious about seeking medical attention and sharing that information. We have to get out of being embarrassed and, don't want to talk about, don't want others to know that we're having these issues. But sometime when you have cheerleaders, you have individuals that's going through what you're going through, it makes it a lot easier. So I would suggest in participating in focus groups, webinars, forums, any type of awareness events like Lunch and Learn series that's actually providing information and resources and bringing you in a group amongst others that's sharing your same issues. I would suggest you join that. It doesn't have to be anything consistent, but, take the time out and you can see and realize that others are going through the same thing and you learn from each other.
Hey there, listeners. It's Stephanie Wynn, your host of the Health and Healing from the Inside Out podcast. I'm super excited to share an opportunity with you. On Saturday, March 22nd, 2025, the Stephanie A. Wynn Foundation will be hosting the 3rd annual Let's Talk IBD Health and Wellness Symposium at the University of South Florida, St. Petersburg. And trust me, you do not want to miss it. This year's theme is all about opportunity, bridging gaps in health equity, mental wellness, and quality of life. You'll hear from amazing keynote speakers like Dr. Jasmine Cohen-Young and Dr. Jennifer Seminario, plus connect with others who truly understand the IBD journey. And here's the best part. My upcoming book, Navigating IBD, a 6-week blueprint for better gut health, will launch on the same day as the symposium. And I'm super excited because it will be available at the symposium as well. This guide is packed with practical tips and personal insights to help you or someone you love take control of their health. Register today at the StephanieAWynFoundation.org and secure your spot. I can't wait to see you there and to personally introduce you to navigating IBD. Together, we'll navigate toward better health. Join us on March 22nd, because where there's opportunity, there's hope. Peace.
You learn from one another on how to cope with and deal with this illness, because it can become real serious. And don't just downplay it and think, oh, it's just a minor stomach ache, because most of us are not physicians and clinicians, and we don't have that expertise. So seek medical attention, be aware, get involved with group forums and webinars and Lunch and Learn series to learn and be amongst others that have the same issues.
That's awesome. And again, that is definitely what we should do. Like, especially if you don't know, like, get in the room so you can understand. Even when you get the diagnosis, get God says get understanding and knowledge, like, and wisdom. And so we have to be able to get an understanding of what is actually going on with our body. What's wrong? What's happening? Can you communicate that to your healthcare providers? And like you said, we said education. We said get serious about seeking the healthcare that you need, first of all. So if you have these issues, get the help that you need so that you understand what's really going on with your body. And then those support groups will follow once you find out what's going on. That's going to help you move along this journey a lot more, easier without feeling like you're alone. So
exactly.
This is really good. This has been a really good interview. Miss Lolita, tell the people about who you are, where they can find you, how they can follow you. Because again, our goal is really to get out here and help our community have better health outcomes. I know that y'all, she didn't tell y'all what she really do, but I'm gonna tell y'all, and I'm gonna let her tell you where they can follow her. But Miss Lolita is actually a community health worker. She in the state. I think she was the first community health worker in the state of Florida.
Yes, to be certified. Yes.
Yeah, to be certified. And so that was prior to her launching Adderall Consulting Solutions back in 2020. And she's held various positions, including customer relationship coordinator with the United States Postal Service. She's also the executive director of the Front Porch program. Listen, she is a powerhouse, and I'm going to let her continue. But I just wanted to let you all know, like, she's out here in the community. So she's done a lot of work. She knows what it's like not to, have the support when you're going through like a chronic illness like this. These are things that we don't like to talk about in our community. And we've been trained, right? We've been taught and trained to not say anything when we have some issues going on. So, Miss Lolita, I'm going to let you take the floor before we conclude and let the people know how they can reach you and what you have going on with your organization.
All right. Thank you, Stephanie. Yes, I don't like to boast, but I am proud that, I'm committed to the community. I love the community in which I live, work, and play. So I'm always on board to be a source or resource for the community. As Stephanie said, I was the first community health worker to be certified in the state of Florida by the Florida Certification Board. I'm also the executive director and programs manager for Front Porch Community Development Association that has been around since 1999. I've been on board since 2001. And Front Porch focuses on health programs and initiatives that involves anywhere from youth, young adults to seniors. So again, health is my baby, my passion, my love, and those programs, I assisted with implementing the programs and facilitating those programs. So I do have a wealth of experience and information as it relates to health and health wellness. I'm also the owner and CEO of Adderall Consulting Solutions, which I launched in 2020. And that is to assist small businesses, specifically minority-owned businesses, with galvanizing and maintaining a solid foundation to assist them with self-sustainability. I've been around as an independent contractor prior to launching my business in 2020, and I know the hurdles and the obstacles of doing work for others and not getting the benefits. So, I help those individuals that have that business idea, that started that business idea, and I help them continue to succeed and be successful and generate as much revenue as they can. So, I love what I do. I have passion for what I do. I have the commitment for what I do. The services I provide, I use the real concept that serving my clients with integrity by being real. And that acronym stands for relatable, encouraging, accommodating, and logical. So to me, using that concept, it helps me to build and be stronger as a professional. And it also helps my clients to receive the services that they entrust me to provide to them.
That is awesome. That's all about serving. Again, you can't be in this. We're out here serving, and that's the purpose of helping the community, serving the community, letting them know like what options are available for them out here, whether you're in the for-profit or nonprofit space. Thank you so much, Ms. Lolita, for explaining that, because a lot of people need to know like what's available to them and what needs to be done as far as, getting their business together. And even when you're having people that have a chronic illness, they still are out here trying to push through and serve the community. And again, we can't do this work alone. But one of the things that, as a gift to the listeners out here and to your audience as well, we created what's called an IBD patient checklist. And so what this checklist is, this helps anyone who is navigating an IBD or IBS diagnosis, if you will, and they find it confusing and don't know what questions to ask. This checklist is free. I'm going to put it in the description note. So for those that are tuning in, you can grab that, download it. When you go to the doctor, these are questions you need to ask your doctor. Like, what is my diagnosis? What does that mean? What does this mean? What type of medication am I going to be utilizing? Are you going to recommend that I start taking? Can I live with this? These are questions that you want to ask because you don't know when you get that diagnosis, it's like you're in shock. But these questions are really simple questions for you to ask the providers or the clinicians, like Miss Lolita said early on in the interview, is that ask questions. And this is the reason why we created this checklist, so that if you don't know, you can take this checklist and you can start asking the questions. So whether you're newly diagnosed or have been managing your condition for years, this comprehensive checklist will help guide you through the essential steps of managing your care and improving your quality of life. So I want to thank you, Miss Lolita. Thank you. Tell the people where they can follow you on social. Are you on social media?
Yes, I am.
Okay.
LinkedIn, just put in Lolita Dash-Pitts and it will bring you up. So feel free to visit me on LinkedIn. My Facebook page is Lolo Pitts. I'll be changing that, but it is professional page. And you can also visit me on that. And I want to leave you with one last statement. The more we know, the more we do. So just remember that. That's very powerful. So carry that with you throughout today, tomorrow, next week. But just implant that and use that to motivate you and to keep going. But yes, the more we know, the more we do.
And I'm going to repeat that. Come on now, Miss Lolita. The more we know,
the more we do.
And that is so true. The more we know, that's how you're going to fight. Uh-huh. If you know more, my mom, if you knew better, you do better, right? Yes. My mom always used to say that. If you knew better, you would do better. And I always kept that in the back of my mind. And that relates to what you just said. So I thank all of the listeners for tuning in to this episode. Listen, subscribe to our channel, leave a rating for us so that we can continue to put this work out, put this content out. And listen, don't forget to download your IBD checklist. You need that when you go to your next appointment. Until next time, peace.
Peace and love. Prosperity.
Thank you so much for tuning in to the Health and Healing from the Inside Out podcast, an online health and wellness podcast where I, your host, Stephanie A. Wynn, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. Be sure to select the subscribe button and let's start the health and healing process from the inside out.